Good afternoon, everyone. My name is Sam Thomas, and I'm the Relationships Manager at Nalasha Healthcare. Firstly, I would like to thank all of you for joining us today for this webinar. It has indeed been a tough few past months for all of us. So I hope you all are doing well, taking adequate care, and are safe. The year 2020 has not been as pleasant as most of us would have expected it to be. The current situation has created a lot of roadblocks in almost all businesses as we see the world's economy taking a gradual hit. Apart from the daily challenges we are facing and the pandemic teaching us multiple things every day, the current situation has also raised some very, very serious questions about our ways of working. With that said, the first question that medical practices need to ask themselves is whether we are actually extracting the maximum potential of our hospital from a care delivery standpoint. Now, in healthcare, for the past many years, we have been hearing CMS talk about value-based care and is trying to push all of us towards a patient-centric approach. But are we really placing our patients at the center of all what we do? That's an important area worth rethinking about. Now, there definitely is no silver bullet to save us from the current situation, but we plan this webinar to address some of the areas that have been challenging for most hospitals over the past many years. From the year 2010, we have been passed a lot of regulations from CMS, but are we actually using our technology resources meaningfully? I'm sure that the things that we cover today would leave you with some more ideas around these topics to ponder over. During today's webinar, we will be talking about various clinical and non-clinical workflows and the potential ways in which hospital operations can be more efficient with better patient health outcomes. During the session, we will have a few polls for all the attendees, and I would request all of you to answer them so that we have a better understanding of you and can hence propose potential ways to improve your current setup. During the course of the presentation, we would only be taking questions through the chat window that you see on the GoToWebinar panel, where you can type your question and send it over to us. We will be sure to get that answered either immediately or towards the end of the session. Post the presentation, we have planned a brief 10-minute Q&A session where an attendee who has a question can raise their hand, which is again from the GoToWebinar panel, where you'll have to click on the hand icon, which is on the top left side of the panel below the mute button. We unmute the attendee and you can go ahead and speak your question, which will be answered by one of our speakers. As the purpose of this webinar is educational and this is not a discussion, we will have all the attendees on mute and will be unmuted only during the Q&A session if you raise your hand and have a question. All right, so I would like to introduce Kirti and Ravi, who are our speakers today. Both of them come with a long healthcare background and have spent more than a decade in the provider space. In the past, Kirti has been focused more towards the clinical side, where she's helped a lot of medical centers and healthcare technology vendors in chalking out their strategic technical roadmap. While Ravi has been working with medical practices, helping them from a revenue cycle standpoint, and has also had experience in the clinical world. Both Kirti and Ravi come with a comprehensive understanding of the clinical and financial workflows, and for the past few years, they have been playing an influential role in helping organizations develop strategies under the value-based care program to obviously improve the healthcare operations and minimize any possible care gaps. All right, ladies and gentlemen, now this session would be a little less than an hour, and we would appreciate your focus during the presentation. So sit back, relax, grab your coffees. I hope all of you have a meaningful session, and in the end have a lot of thoughts to ponder over from the areas that we talk about today. Over to you, Kirti.
Thanks, Sam. Good evening, ladies and gentlemen. Hope all of you are healthy and safe. Thanks for joining this webinar in your busy schedules during these current situations. As you all know, this pandemic is massive and unplanned, leaving all of us in chaotic situation. This again proves that healthcare ecosystem is recession-proof but not pandemic-proof. What can make this pandemic-proof? Why so much of chaos while there is a lot of advancement? We've been analyzing multiple processes and systems across healthcare ecosystem for the last decade, and surprisingly, we came across a major observation. There are multiple systems in place like EHRs, practice management solutions, RCM solutions, portals, patient engagement apps, population health management, etc., which does their internal workflows fantastically. However, as a whole, there is no orchestration between the systems, which brings the gap in the workflows. Let's take a look at some of the scenarios here, uh, starting with outreach. Let's take some of the hospital situations as examples we want to quote. So, outreach. Uh, so, the COVID-19 breakout has brought a lot of financial repercussions with canceled procedures, postponed tests, and the need to treat millions of newly unemployed citizens who lost their health coverage, which they once previously had. Based on the observations last few months, this behavior is not going to end very soon. It might continue for some more time. However, before this settles down, hospitals should start working on stabilizing plans by preparing to how to resume the halted services. To resume these halted services, outreach teams should continue focusing on the patient journeys, tap the patients about their health conditions, notify them about their rescheduled dates with their procedures, and make sure once planned patients or scheduled activities are intact and that is not disturbed. How is it all possible? This could be made possible by a very good, well orchestrated system which identifies the list, keeps a tab on them, notifies them, and all that. Moving to the next scenario, prioritization. During this pandemic, there is massive wave of patients coming into the hospitals while some of them are visiting just out of fear and not actually infected. So if there is a mechanism like which mandates the patients to fill in their assessment forms from the home prior to the visit, if if at all there is a capability as such to automatically process these fill forms and suggest the risk code to the patients, that not only calms down the patients but also helps the patients in decision making if they need to meet the doctor in person or not. Also, some of you are ACOs complying with two-sided risk, in which case, while the frontline workers take care of the corona patients, they also need to ensure that the registered patients with their wellness programs are health safe and improving. There is no time for manual interventions to alter the care plans for respective population manually. Also, this activity cannot be skipped because that's the only thing which keeps them, which lets the caregivers track how the patients are. So, if at all there is an intelligence in the system that can automatically bring the complete patient journey that can and present the exceptions to the frontline workers, then decision making gets pretty simpler. Uh, Maybe not simpler, but easier, I would say, because the caregivers or the wellness teams get to know what exactly is going on with their patients. That ways, system should be able to guide them who what changes they need to do, what changes should they follow with respect to the changing health conditions. That gives a lot of benefit of time, not only to the caregivers, but also for the patients. Moving to the next one, self-screening. If patients have the capability to self-screen themselves through portals, patient engagement apps, that not only helps the patient gain confidence, but also helps hospital to get factual information about the patient. And that is good again for the hospitals as well as for the patients. So the overall outreach activities can be planned better. Then coming to patient tracking, again, here I'm not referring to GPS tracking of patients, but tracking the exact health condition of the patient. Knowing your patient is very important at this point of time as they cannot come and meet in person with their doctors. Instead of patient reaching the providers, if providers can tap their patients, that improves the whole dynamics. For this again, again, we just don't need the telehealth capability, but there should be an addition on top of it, which identifies the high-risk patients, schedule telehealth appointments, and when the appointment is happening, if at all there is an NLP processor, natural language processes, which converts the conversations to text, the speech to text, that makes the entire documentation easy, and providers can spend more time with the patients. Provider efficiency, overall, that is the core. Patient safety can be harmonized only through provider efficiency. Providers are already working double the shifts to help the patients, and they will need different tools to improve their efficiency. Planners, which help them, so some of the tools like planners, better visualization tools, KPIs, help them to improve the whole activity. Similarly, event-based interventions and capacity forecasting also helps the providers and the frontline workers to be more efficient during this pandemic situation. Now, while we say all this, let's see what exactly the VBC is saying. While these are the core tools needed for the providers, hospitals to overcome this pandemic, let's take a look at the VBC dictations as well. They are also saying to improve provider reach, build the infrastructure to support preventive care, ensure patient didn't get readmissions, right decision-making tools to improve quality of care, get the patient factual information, interoperability and transparency by educating patients of their care plans and the plan, and plan well for reducing the overall overheads. So if you compare what VBC is saying and what is required during this pandemic, they are in line with each other. So if hospital system comply to these requirements, facing the pandemic COVID-19 gets more organized. Don't you think so? Let's take a poll question here.
All right, so we have the first poll coming in for the audience, which says, what have been your primary challenges during this pandemic? You have your options below the question. You can choose the one that best resonates with your situation. All right, thanks a lot, everyone, for answering that.
So let's take a stage-by-stage scenario and see what processes should be there in the system that makes the whole workflow easy for every stakeholder here. Now I'm handing over to my colleague Ravi.
Thank you, Kirti. Good afternoon, everybody. Here, I will be trying to briefly cover some of the common problems faced by the clinic and the patients, while Kirti will discuss the possible solutions for these problems. Talking about the patient's journey, starting with scheduling. When a patient calls in for an appointment, there is usually an eligibility check performed by some practices. But if the patient is not eligible, the staff may probably try to reach the patient or completely forget to make this phone call. So the patient is not informed or communicated, and the patient probably shows up with an non-renewed insurances. I mean, if in case he was informed in time, the patient might as well had renewed his insurance or shared a different insurance.
Now, as Ravi mentioned, this is quite common, but especially in case of this pandemic situation where everybody is rushing to help the patients, is there time to call the patient and inform about their eligibility? I don't think so. So if at all there is a solution which when the eligibility checks are performed and when the responses are received, if this information directly gets informed to the patient via the portals or the engagement apps, then the patient is well informed and the patient knows whether they have to continue with the visit or whether they have to wait for another insurance. That overall helps both providers as well as patients to be well prepared for their visits.
All right. During situations like COVID-19, it gets very difficult for facilities to screen large number of patients in a short notice. Furthermore, the facilities may be spending more time on a patient with mild or no symptoms, whereas a patient who needs critical attention might be waiting.
Exactly. So prioritization. prioritization is very much required. If at all, there is a capability to identify the patients who might be possible or having the high risk score for the screening. If at all the prioritization is available in the system and they're notified, then it is more organized. Now, looking at the systems, what are required? It's more of communication between the systems, where like billing system, admin systems, where people will be notified about it and the providers will be notified in the EHR. So prioritization happens. Moving on to the next phase of the patient journey.
Yeah, talking about pre-visit, the patient forgets the appointment. Sometimes the patient book an appointment well in advance. If there's no proper reminder system in place, the patient might forget the appointment. It may not be intentional, but it's still a no-show. Had there been a system in place where the patient is reminded just before the appointment, the patient wouldn't miss it.
Right. If at all, right now, I wouldn't say there are no reminders going, but then there are reminders which are going as messages or notifications. But what happens is generally this happens when the appointment is booked. So on the actual day of the appointment, there are chances where patient forgets the appointment. So if at all this information synchronizes into their patient calendars, because that's first thing that the patient do, may not be patient, everybody, we all does it. First thing, we wake up in the morning and look at the schedule, how busy we are and what is the plan for the day. So syncing into the calendars will be more useful.
Sometimes the instructions are verbal. A patient may not always remember these instructions provided while booking an appointment. The things like not to have breakfast because the patient is going a blood sugar test the next morning, or not to consume alcohol the previous night before the lab test. The chances of patient forgetting these instructions are very high when it's verbal.
Yes, if at all, just in conjunction with the above statement, if that instruction is also going into the calendar, yes, patient gets a notification and patient is prepared.
Check-in formalities at the clinic. Based on our experience and some high-level research, we understand that on an average, a patient spends 20 minutes filling the check-in forms. Assuming that the clinic has 10 to 15 patients visiting daily, there has to be a dedicated staff member handling this queue and ensuring the check-in forms are filled in. Not just that, the spelling mistakes and illegible handwritings are another challenge to handle.
All right. If at all there is a capability to do this from home, especially in case of COVID situation where social distancing is required and where everyone is supposed to stay back where they are. In this situation, if at all these check-in forms can be filled by the patient at home, that not only improves the whole workflow or the time that they're spending in the clinic, but also the patient gets to know whether they're really required to immediately meet the doctor or not. So if at all there are risk assessments and the scores get calculated based upon the check-in forms, which indicates the patient their current situation, that calms them down. Now, looking at the solutions that are required, one, synchronizing to calendars, alerts and notification, education resources, and assessment forms or the check-in forms. Moving to the next stage of patient journey.
Consultation. Now, when a patient is visiting a provider, the provider is possibly looking at an EHR. Now, the EHR only paints a clinical picture, things that happens within the clinic or the home care setup. Now, the patient may be getting the best of the treatment by the provider, but the patient ends up revisiting for the same problem. Now, little does the provider know about the patient's living conditions or economical background could be the reason and not the quality of care.
Right. Knowing the patient is very important because even if the provider thinks that the right treatment is being given to the patient, why is the patient not improving? We might think that financial condition and the social conditions of the patient may not be relevant to the treatment, but then that plays a very important role because if at all the patient have no financial capacity to take the medicine, then patient is not improving, ultimately impacting uh, the plans of the providers only.
The prescription the provider writes today could be as per the provider's preference. Assuming that the provider is prescribing it based on the choice medically for the present illness, the patient may not be able to afford it because the medication costs probably around $200 for 30 days and patient cannot afford it. If the provider knew the social or the economical background of the patient, the provider could prescribe a generic medication of a much lower cost.
Right, just in case the social and financial status of the patient comes into the system and system automatically alerts the provider that this is the condition of the patient, then provider can immediately check with the patient if they are they are in a feasible situation to continue that medication or they require alternatives. Now, if at all there are integrations which brings the alternate medicines for the provider to suggest alternatives like generic medicine or a low cost medicine, that not only improves the health of the patient but also for the provider, the provider's treatment can be improved.
If only the patient is further educated about the current illness, the medication, so that the patient understands the risks involved and would follow the instructions.
Yes, patient getting the patient being able to track the usage of the medication is very helpful because at times the patient might they might forget how exactly to take the medication. So these instructions going handy to the patient are very helpful. So looking at the systems that would be involved here, one is integrations between different systems where the education is brought and a provider is given help for better treatments. Then moving on to the next stage of patient journey.
The patient forgets the lab appointment, maybe due to the mental stress, or the appointment was booked really long ago, or the patient just doesn't remember it. There was no proper reminder in place.
Yep, again, reiterating if at all these reminders get synced into their calendars, that would be very helpful.
The instructions are verbal or absent. If a patient was due for a lab test, let's say a cholesterol and a glucose test, the patient should be fasting for at least 8 hours, drink plenty of water, etc. But if all these instructions were verbal, the chances of the patient forgetting them are very high.
Yep, these instructions can also be synchronized into their calendars that helps them to be well prepared because not all lab tests have to have the same prerequisites to be followed. So it will be helpful if the information is handy for the patient.
There's no visibility of the medication adherence. The practice usually has no record if the patient really picked up the medication. Chances are of the pharmacy being inaccessible, they were too expensive. There's absolutely no visibility. If the patient had discontinued the medication or is irregular, there could be days when patient goes without medication and the clinic wouldn't know.
Right. If this information flows back, whether the patient have picked up the medication or not, if the consumption is in progress or not, if this information goes or sinks into the EHR system, either from the devices of the patient or from the integration with the pharmacy systems, then there is more visibility for the care teams to ensure that patient's health is improving. So looking at the systems that are involved, it is more of tracking and integration with other systems to bring the data back and forth. Looking at the next stage of patient journey.
Inpatient admissions, where the communication is verbal for alternative care, where a registered nurse or a case manager is discussing with the patient about the processes and the possible alternative care. The patient may just go by the face value and would not really think about the repercussions or could get confused. How do we ensure that the
Right.
same care or alternatives are with the patient in some form of record?
Right. These days, eligibility checks are happening, or prior authorizations are happening. Now, when this information comes back into the EHR systems or the practice management systems from the payer systems, this information can flow till the patient, then the patient will know their benefit information in further detail, and they can look for alternatives if they cannot afford it.
The financial charges that's communicated to the patient during admission could be different from what they see at the end during discharge.
Very common, because as the treatment progresses, there will be different situation that more treatments or more services will be rendered for the patient. So if at all patient is informed in shorter intervals about all these details, or their family members are informed, it becomes easy, and patient can be well planned.
The patient may not be always aware of the next steps. If they should be undergoing a lab, if there's an X-ray to be done, an MRI or a CT, how do we ensure that the patient is updated at all stages?
Right. The whole plan is known for the providers and the care teams, but it is not known to the patient. So, if at all, there is a chance to give the transparency to the patient as well. For example, there are televisions in all the patient rooms. So, if at all there is a notification on the television or some notification on their mobile apps, what is going to happen in the next day or 2 days after, along with their family members, it makes them more prepared, and there are no panic situations. Now, looking at the systems that are involved here, it is more of information flowing from one system to another, where people are educated with different educational resources. Moving to the next stage of patient journey.
Talking about discharge summaries, a patient is usually given a discharge summary, but how many patients really spend time reading it? If there was a way to simplify this for better understanding, it would definitely help patients.
Right. Discharge summary at the end might be cumbersome for the patient, just in case there is a care plan which they have to adhere to after the discharge. Patient may not focus it because they might be busy in getting discharged, doing the final settlements and other things. So, if at all there is a bite-sized summary which is given at different stages, then there is always, for example, patient finishes a lab and then they are informed at that point of time when is the next lab that they need to perform. Then they are well informed. Again, exchange of information.
During the time of discharge, the patient is eager to return home and has been through some financial expenses too. A feedback at this time may not be true to what the patient intended. So, how do we ensure the right feedback is received for better quality care?
Right. Feedback is very important for the hospitals in order to identify where the problem is. Now, taking the feedback at the time of discharge may not be really helpful, because patient will be giving the feedback with the mood that the patient is in at that point of time. So, for example, patient had 2 weeks of stay at the hospital, and the first week is fantastic, and then uh, just a day before the discharge, the patient is upset with all the services. There is always a chance of getting a negative feedback, uh, and vice versa. In order to the whole purpose of feedback is to improve the processes. So to get the actual feedback or the factual information, it's always better we do it bite-sized at different stages.
Post the discharge, the patient may not be aware of the expenses, the co-insurance, the amount the insurance paid, and the adjustments. So clearly, this could be a stressful thing for a patient at times.
Right, exactly. So if there are two versions, where one is a summary version and the other one is itemized version, when the reconciliation happens from the payer, that's when, if the itemized version goes to the patient, and while the time of discharge, if at all they get a summary version, they exactly know what is out of pocket for them, and the time can be saved for everybody. Now, looking at systems that are involved, it is more of mobile integrations, device integration, knowing the complete journey of the patient. Moving on to the next phase of patient journey.
Now, most existing applications have a dashboard or a graph which gives a high-level view of overall patients for the care plan. Now, a care team member has to dig through these reports to identify the right patient for intervention.
Right. With different care programs and plans, there are multiple dashboards and reports available. But how precision targeted is it? That is not very clear. Now, if the caregivers need to know who are the risk patients, they have to dig deeper into every chart or report to see who needs what type of treatment. That needs to be more granular, and it needs to be, if at all it paints the entire journey of the patient, that will be more useful for everybody.
The care team members are spending a lot of time working on reports, applying filters, checking all the parameters in order to perform further action. The action could be tedious and not an effective way for a care team member uh, to spend time. Now, if at all there was a system in place which could apply all these parameters and uh, point at the patient who really needs the care, that would save a lot of time for the care team.
Exactly. So that improvises the whole process, because system, not only the KPIs, but if it identifies who are the risk patients and what treatments to be changed for those patients, what are the current conditions of the patient, what is the other aspects like the financial and social aspects are also brought into this, not just the clinical dimensions, then the caregivers can do better care plans for their patients. So the whole journey is very important at this point of time, and that only gives the clear picture for the care teams. Now, looking at the systems involved, integrations that bring information from social media, because that's where we can know what is the exact social status of the patient, the condition of the mood of the patient, and other things, and painting the complete journey of the patient, where exactly the patient is going, are they taking the medications or not, and other things. Moving to the next phase of patient journey.
Now, this is what we've been talking about, the social angle. A patient situation is usually based on the data points discussed during the 15-minute visit at the clinic. The patient may not be socially active and undergoing a lot of stress.
Yes, systems need even that information. So if there is a capability to bring this angle into the systems through other integrations, then nothing like that.
Now, the current understanding of the patient is limited to the discussion at the visit. Now, the clinic may not know if the patient is working out. Does the patient have family and friends? Is the patient interested in good health and have goals, etc.?
Right. If at all, if there are multiple channels to bring the patient information into system, like their devices or mobile apps, integrations with the family tools and other things, that brings a wellness that helps in measuring the wellness of the patient, and then based on that, decisions for the clinical decisions can be taken appropriately.
Now, the care plan shared with the family may not be updated in some cases, and the shared document is probably really a long document that the patient's family really does not have enough time to go through. So, if there was an effective way to use it.
Right. Along with the patient, if at all the care plans are shared with the family members up to date, that actually helps in promoting the overall health of the patient, because just when the grandson or a granddaughter get the care plan of their grandmom or a granddad, if they can check whether they have taken the medication, that makes them happy, as well as there's someone to track their health. So promoting this engagement is pretty important.
Without an effective system in place to identify the patients who need intervention, chances of having an out of context call with the patient are too high.
Right. Just imagine all the social angles. The family members are involved in the care plan and other things. So if there are different integration that brings the device information of the patient as well the vital information of the patient. If all this data is there, don't you think the calls that the wellness teams make are more meaningful? Yes, they are. So looking at the systems that are involved here, the patient journey, social engagements, device integrations, and information exchange. Now, we have seen different aspects of the patient journey. Let's take a quick poll question.
All right, ladies and gentlemen, we have the second poll question here, which says, would the solutions that we saw on the right blackboard help you improve your care delivery? You can choose the most appropriate option. All right, thanks a lot.
Thanks everyone for that. Now, let's take a look at the focus areas across the care. So just as let's recap what we have seen in the past in a couple of screens. So patient journey orchestration is definitely the key here. If at all the entire information, how exactly the patient's journey is going on, where the patient is going, what are the social conditions of the patient, what are the vital situations of the patient, if that entire information is coming into the EHR system, won't the treatment or the care given be smooth or more efficient? Yes, it'll be. So for that, we need real-time wellness monitoring, which means that brings the inputs into the patient journey. The AI-powered alerts, notification, and worklist. This actually, again, sends different alerts, education information to the patient, which again helps the patient to improve better. Unified care collaboration. There are different people involved, the caregivers, providers, patient, and also patient family members. Now, collaboration between all the different stakeholders needs to be same on the same page, and then information should be moving back and forth between different systems. What does that help in? That again helps in knowing the patient better and track the journey better. The next one is omni-channel outreach, which means different channels of outreach to again know the patient, integrating with different systems to know the patient better. That eventually results in 360-degree view of the patient, where all the different stakeholders get the complete picture of the patient. Now, now I think all these systems, as we spoke in the beginning of the meeting, all these systems are available in most of the units. Now, what is missing? Let's quickly take a look at it. If you look at these icons, they are self-explanatory, but let me just quickly reiterate. They are more about communication, reminders, alerts, notification, education resources, device integrations, mobile apps, integration with all the different places where the patient is going. Now, if at all these things are there within the system, some of them are already there in the system, but then it helps in painting the whole patient journey. Now, some of them are there in the system, but what exactly is required in that case? It is more of orchestration that is required. So in order to do this orchestration, we might need some extra tools like artificial intelligence, different dashboards and reports, integration with different systems, then workflows, and some robotic process automation. So just if these are there, which builds the bridges between different systems, that brings the information into a centralized location and gives the complete picture to the caregivers, wellness teams, and the providers, that brings the complete patient journey. Now, here is the moment of truth. So with all these systems, what we say is, yes, there are different systems that are involved across US healthcare ecosystem, but then what makes these systems talk fast? We have come up with one of the solution, which is offered by Microsoft D365. Now let's quickly take a look at what can this solution do. So as you see in the screen, you see different colors across different stages. For example, pre-visit, during visit, post-visit, admissions and discharge, and wellness management. Across each of this, you see different colored tiles. Why different colored tiles? Each tile represents a different system. The green represents clinical, blue represents financial activities, and the purple represents admin activities. Now, for each workflow, there are so many systems that are involved, which means to bring a complete picture about the patient, these systems should be talking to each other. There should be somebody who orchestrates that flow. Right now, these orchestrations are happening, but then these are people dependent. Now, in the situation like these pandemics, what happens is everybody should be involved in giving care and in the some or the other activities. Now, in that case, who will take care of these operations? So there needs to be a system which orchestrates all this. Now we are talking about D365, which have a couple of add-ons on top of it, which we offer, like artificial intelligence, custom process or orchestrations, which are workflows, device integrations, robotic process automation that helps in orchestrating all the systems together. Now, what will we achieve with this? We'll have better patient engagement, quality of care will be improved, interoperability where patient's journey is transparent to each and every stakeholder, and overall population health is improving. That means better provider utilization, healthy patients, and then the overall costs and the overheads are coming down, and accelerated dollars. Is it not fantastic? Let's take a poll question now.
All right, ladies and gentlemen, so looking at the final solution, so we have a next poll which says, do you think such a system would make sense for your medical center and solve some of the business cases that you intend to? You can again choose the option that resonates best. Thanks a lot for that.
Thanks for that. And now let's take one more step where we, till now we saw the clinical challenges. Let's take a look at other systems that would be involved. For example, admin and operations. This comprises of doing the population health dashboards, which are missing. So they have to check for that. Collaboration views are missing, which needs to be taken care of it. Overall staff performance would be impacting. So if at all there is D365, there will be a rules-driven resource management, centralized coordination communication, and other activities which actually helps in identifying the risk work list or the patient list, which helps in taking better actions. Next, moving on to the billing department. Yes, this is a two manual department where back and forth communication should happen with different payers and back to the providers in checking the right codes are there, right author, and then going back to the patient if there are authorizations and eligibility information is missing, then they have to bring that data into the system by checking their details. So there is a lot of back and forth action which happens in this. Now, in this kind of system, if at all there is a rules-driven biller work list which decides what activities the biller should do first day in the morning, and if at all there is collaboration with the providers where automatically based upon the edits that are made, if the provider gets to see what are the edits that are made, and if there are reminders that go for the invoices and the payments and the collections, yeah, that's fantastic, right? All that can be automated. Then looking at customer support, again, this is one more department where there is a lot of human activity which goes on, where they have to follow up for everything with either the patients or the payer systems, payers or the labs, pharmacies, and everybody. They are the backbone of communication for the entire department. Now, if these people have a 360-degree view of the patient, then they can communicate well with the patient. They can close the call in 2 minutes with the respective information because patient trusts them. And if at all there are automatic reminder chat bots where anybody asks them any question, if there is an automation that goes, bring the information from the system and automatically deliver to them with artificial intelligence and automated surveys, nothing like that, right? Moving on to marketing. Now, as part of the marketing, outreach is the most important activity. And at this point of COVID, outreach activities needs to be pretty well planned because timing is very important. So all of a sudden, once the COVID settles down a bit, everybody should be focusing on their outreach activities. Now, there is no enough time for the resources that are available versus the activities that needs to be done. So in that case, again, automation brings a lot of help between different systems because it can auto run campaigns, solutions. It can bring the entire content about the patient and the digital, whether the patients are going through it, who are liking it, it brings the footprint. Now, everything, all these use cases can also be automated and well achieved with D365, not just the clinical. Let's take a poll question here.
All right, so here's the final poll for the attendees. It says, which among the non-clinical challenges best describe your current situation? All right, thanks a lot.
Thanks, everyone. Now, when we have seen a lot of things, now the next question which everybody would be having in your mind is, how big is the system? You're talking about a lot of automations. Then how long will it take to implement? So to answer that, it is more like the toppings that you select on your pizza. So it is a customized solution where you need not implement the entire 9 yards to get use or to get the results out of the system. Rather, you can implement from module to module. So if you see here, it's pretty clear like how we generally implement these solutions across, where we take the modular approach. We do the administration module, customer service module, integrations module, and then bring the rules engines, dashboards, and patient proofing. So these are some examples which we have put here, where we can go chunk by chunk, and then we can achieve one by one module. So what happens is, once the module is complete, it can be moved to UAT and then moved to production release, and it need not wait for other modules. Everything can be executed individually. And the best part is, it is not going to take months or years. It can be executed in weeks. So that's the overall way that we want to present this solution, where based upon the customer's need, we can just implement one module, or we can implement 2 or more modules, or the entire solution. So it can last between couple of weeks till, or it can go till 20-30 weeks as well, based upon the number of features that you would like to implement here. Any questions?
All right, thanks a lot, Ravi and Kirti, for all that information. That was really helpful. I'm sure this would help our attendees channelize their future efforts in the right direction. All right, ladies and gentlemen, the floor is now open for questions. You can either type and send us your questions through the chat window in the GoToWebinar panel, or you can raise your hand by clicking on the hand icon. We'll unmute you and you can then speak your question. All right, we have the first question coming in from Adam Paul. Adam, I'll unmute you. You can go ahead and speak your question, and we'll have that answered by Kirti or Ravi.
Hi, this is Adam Powell. I've got a question. All this sounds pleasing and beneficial from the first look of it. However, from a hospital standpoint, what are the challenges that your partners have faced in the past, while implementing such a system for their medical centers? Like we have 5 centers in 5 states with different solutions used. Now, would that somehow be a roadblock?
Hey, Adam. That's a nice question. So that should not be a roadblock, because the whole intent of the solution is orchestration. You have seen me focusing that part a lot here. So orchestration can be through multiple channels, as I mentioned. So one of it could be integrations. And as you said, your 5 centers would be having 5 different solutions, or EHRs, if I can take the name as. So each of these solutions have different interoperability channels which we can integrate with, and based upon the workflows that you want to automate, that's where we bring different solutions on board. If at all you want to automate the workflow within the solution, then we don't take a look at integrations. Rather, we take a look at robotic process automation or the workflow engines. So based on the need, based on the workflows, we jot down what is the need, and based on that, we put the solution. Hope that answers.
Yeah, that's fair enough.
All right, thanks a lot for that, Kirti. All right, we have another question coming in from Calvin Butcher. Hey, Calvin, I'll unmute you. You can speak of your question, please.
Yeah, hi. We are an Epic shop and we use Salesforce as our CRM for most of the administration activities. But I was interested in the intelligence part. So let's say if I want to leverage only that part, so how would I do the setup?
Certainly. Again, a very good question because it again helps in explaining how the solution works. So this works as bits and pieces. So uh, uh, based on the component that you want to integrate with, and it could be any solution have their APIs to integrate with. So we have our integration engines which can connect to those APIs, bring their necessary information, and then we orchestrate all the activities. So it is practical and doable.
Okay, thank you.
Thanks a lot, Katie, for clarifying that. We have another question, I think that's coming from Keith Nichols. Hey, Keith, there you go. You can speak your question now.
Yeah, so I just wanted to understand, like when I talk about orchestration of workflows, everything is fine. But suppose my patient goes to another hospital and I have around 400 hospitals in my state. So do I need to integrate with all of those?
Hey Keith, so that's where the concept of HIAs come, where we can integrate via the APIs to the HIAs. So even HIAs are providing the API capabilities these days. So we can integrate with the HIA to bring the exact patient journey. However, some patients might be integrated with the HIA, some may not. So in that case, we can also say we track using the patient engagement apps to exactly know where the patient is going. So different channels have to be analyzed as part of the engagement, and based on that, we give the solution.
Got it.
All right, thanks a lot for that also, Keithy. I don't see any more questions coming in. All right then, thank you everyone for your time and patiently observing the shared content. A recorded version of this webinar will be available on our website soon. We'll also be sure to share a link with all you attendees. You can also reach out to us if you have any questions or clarifications. We'll get back to each one of you personally to have those answered. Please feel free to drop me an email if you would like to discuss anything related to the webinar, or otherwise, we're always happy to share thoughts. I guess all of you have my email from which you received the webinar invite. Feel free to drop me a note there. All right, then, that was all we had for today. I look forward to hearing from you. You all stay safe, and there definitely is some light at the end of the current tunnel that we are in. Take care and have a pleasant evening. Thank you.
Thanks, everyone.
Thank you.